Advances in treatments and survival rates with those diagnosed with colon cancer have increased greatly. The National Cancer Institute estimates that more than 1.1 million Americans with a history of colorectal cancer were alive in January of 2007. Some of these individuals were completely cancer-free. We spoke with the specialist at Florida Hospital Waterman Cancer Institute about the importance of prevention and early detection to improve your odds of beating colon cancer.
Colon cancer is an equal opportunity disease. Women and men get it. It's more common as people get older. We do know that if you detect it early, you have a much better chance of curing it. And so that's why colonoscopy is a very important component of screening for cancer.
Colorectal cancer is a cancer which is usually detected by colonoscopy, and it is very treatable. We have a large experience of doing laparoscopic colorectal surgery, which results in better outcomes for the patient in terms of returning to work earlier and a shorter hospital stay and less pain and discomfort. The key aspect of treating colorectal cancer is that the surgery has to be adequate, in the sense that for colon cancers you have to take out a minimum of 10 to 12 lymph nodes in order to adequately stage the patient. In terms of genetics, there are certain genetic abnormalities which predispose you to developing colorectal cancer. One of them is the Lynch syndrome, which is a genetic defect, which is autosomal. It's where every single member of the family who has that particular gene will develop colorectal cancer by the age 50. Now that is huge because it's really important for those people to have adequate surveillance, to detect anything early and also adequately treat them. In fact, there are recommendations that these patients have their colon removed by a certain age to prevent them from developing the cancer. As far as lifestyle goes, it's essential to understand that dietary habits do play a role in protection against colorectal cancer. In that, patients who don't consume adequate amount of fiber in the form of fruits and vegetables definitely have a higher incidence of colorectal cancer. I think it's a combination of environmental factors and genetic factors which determines whether the patient will develop colorectal cancer or not.
For more information on the treatment options and services offered at Florida Hospital Waterman Cancer Institute, you'll find them by clicking the Colorectal Cancer Awareness Story link on our homepage, yourhometownhealth.com.